Marvy Turner of Columbia spends a lot of her time in the gym, especially on the uneven bars.
I just love how it gives me like a ton of adrenaline. I also love the uneven bars. It just makes me feel like I'm flying.
But 2 years ago, Marvy's wrist started hurting, and it progressively got worse after the continued pounding of gymnastics.
Vault was probably the most painful part out of all the events.
Push.
And also handstands, that hurt quite a lot too because it hurt to put the pressure on the wrist.
About 40% of gymnasts are diagnosed with this problem. It is an overuse injury involving the growth plate of the radius, the forearm bone. If caught early, rest decreases the inflammation. But in Marvy's case, it was much more severe. Her radius bone had stopped growing, while the other bone in her forearm did not, causing severe pain in Marvy's wrist. Surgery was the only solution. Orthopedic surgeon Julia Nolli shortened one of the bones so they lined up, returning full motion to the wrist.
What is a shortening? It's essentially taking a wafer of bone out and then bringing those bone ends together, essentially creating a fracture and then holding it together with a plate. And so we have to allow that to heal.
When Marvy's cast came off, her family could not believe the results.
Right out of the gate, cast comes off, suddenly she can turn it 180 degrees. She hadn't been able to do that for 2 years. It was just incredible.
I started crying actually. I was just so happy.
Anytime I have a patient that I can clear for full activity and they're so thrilled to get back to it is what makes my job so rewarding.
Marvy's back in the gym, doing what she loves, pain-free. From the University of Missouri, I'm Teresa Snow.